Welcome to the FilterWire EZ Embolic Protection System training video. Product preparation. The FilterWire EZ system is comprised of 1 protection wire with incorporated filtration system, 1 peel-away EZ delivery sheath, 1 EZ retrieval sheath, 1 accessory kit containing 1 peel-away introducer sheath and 1 wire torquer. The protection wire and sheaths come packaged in 2 protective coils. Note that the EZ delivery sheath is indicated by a black handle and the EZ retrieval sheath is indicated by a white handle. Begin product preparation by unclipping and removing the yellow protective cover surrounding the filter. Disengage the preloaded protection wire from the rubber retaining clip. Completely remove the sheathed wire from the packaging coil. Dip the filter in a heparinized saline solution while loading. While immersed, pull back on the wire and gently draw the nose cone into the EZ delivery sheath until resistance is felt. The non-jamming nose cone is designed to enter the distal tip of the EZ delivery sheath 1 to 2 millimeters. Insert the device into the introducer sheath, and then the introducer sheath into the hemostasis valve. Pre-procedural pharmacology review. Standard patient preparation commonly used in angioplasty is recommended when using the FilterWire EZ system. All patients should maintain an activated clotting time greater than or equal to 300 seconds or greater than or equal to 200 seconds if a GP2B3A inhibitor is being administered. Angiographic Considerations. Before beginning the procedure, identify the filter landing zone using the following criteria. The apex of the loop should be deployed a minimum of 3 centimeters distal to the target lesion. The FilterWire EZ system should be placed in a vessel segment between 3.5 and 5.5 millimeters in diameter. Note that there must be at least 3 centimeters between the distal edge of the lesion and the distal anastomosis to avoid stent placement interference. Suboptimal landing zone. An example of a suboptimal landing zone is evident in this case where there is less than 3 centimeters distal to the distal portion of the lesion. Trying to place the device in a short segment between the lesion and the distal anastomosis may result in the loop and filter interfering with stent placement. Another example of a suboptimal landing zone is illustrated by this case, where the diameter of the vessel is larger than 5.5 millimeters. This will not allow complete device apposition and therefore incomplete protection. Device insertion and advancement. After inserting the introducer sheath into the hemostasis valve, remove the introducer sheath entirely. The device is now ready for the intervention. When advancing the device through the guiding catheter, advance both the protection wire and the EZ delivery sheath together using a one-handed technique. Aiding the vasculature, use a two-handed technique, advancing the EZ delivery sheath with one hand and torquing the wire with the other. To prevent premature filter deployment, do not push the wire as you are torquing it. If the lesion is difficult to cross, consider using a buddy wire technique. Predilation with a small balloon catheter can be used as necessary. Filter positioning and deployment. Use device markers to confirm device position in the predetermined landing zone. Secure the wire in place by advancing the torquer to the hemostasis valve. Tighten the torquer firmly on the wire. To deploy the filter, stabilize the wire using the torquer and pull back on the EZ delivery sheath until the filter loop is deployed. Then peel away the EZ delivery sheath until the clear section at the distal end of the sheath appears, indicating the beginning of the short monorail segment. Once the filter has been deployed, remove the EZ delivery sheath completely before performing initial contrast injections. If repositioning of the wire is necessary, use the EZ retrieval sheath to recapture and redeploy. Performing the standard technique. To avoid excessive movement of the filter during the procedure, stabilize the protection wire when exchanging devices or when repositioning the guiding catheter. Check flow frequently during the procedure. If there is slow flow, consider removing the device and replacing it with a new one. If at any time during the procedure there is no flow, immediately remove the FilterWire EZ system with the EZ retrieval sheath and replace it with a new device. Filter retrieval. During filter retrieval, use the EZ retrieval sheath indicated by a white handle. To retrieve the protection wire and filter, advance the EZ retrieval sheath to the filter loop. If it is difficult to advance the EZ retrieval sheath through the stent, try the EZ bent tip retrieval sheath. Secure the retrieval sheath and pull the protection wire proximally until resistance is felt. Check fluoroscopy to assure the distal edge of the collapsed filter loop is even with or proximal to the retrieval sheath marker. After successfully capturing the filter, remove the sheath and protection wire slowly as one unit.